You're listening to C103's Cork Today podcast. Phone and text lines are currently closed.
And we're going to the Health Hub Times Square in Ballincollig, where Anneliese joins us. Good afternoon to you, Anneliese.
Good afternoon, Patricia.
And you are very welcome. Okay, a lot of questions coming in. Let me start with one that came in bright and early this morning from Anya. Hi, Anneliese. I'm 3 weeks post-COVID, still coughing and still very hoarse. I also have black circles under my eyes. Any suggestions, please? The never-ending recovering from COVID.
Yeah, absolutely. Now, I don't know, if there's mucus involved, like in that cough, so if you're still kind of bringing up mucus from your chest, I could definitely recommend the Dr. Clare Mucotone, because it's full of stuff to boost the immune system, but also for kind of the chest health. But if it's a kind of a very dry cough, you might do better with something like what I used when I had COVID recently was the Manuka Honey Elixir. It's by Comvita. And I just would take it when I was coughing because it would stop me going into those complete and utter spasms of coughing. And I think that's what nearly wears you out. So I could certainly recommend that if it's a dry cough. So if the Mucotone, if there's mucus, and the Comvita Manuka Honey Elixir, if it is a dry cough. Now, sometimes those big black circles under your eyes are iron deficiency. So the first thing I would suggest is that if your iron has been low in the past, maybe take a tonic with some iron in it. Not many of them have iron in it now, so you'll have to make sure you ask if you go into the health shop or the pharmacy for a tonic, make sure that there is some iron in it. I think that like the Floridix is available everywhere, and there's iron in that, very easy to take, it doesn't make you constipated, and there's also the B vitamins. So that could do well. And then, of course, if your iron hasn't been low in the past and if it's unlikely you eat loads of red meat, then there's nothing that beats the Source of Life Gold as a tonic to pick you up, because the ginseng in it gives you a great boost. So, and there would be some iron in the Source of Life Gold, not a whole pile, but there is a lot, and you could maybe just increase the amount of red meat and liver that you're eating for a week or two.
Okay, somebody was recently on a high-strength antibiotic and wonders, can a high-strength antibiotic affect your hair? She finds her hair has gone very thin, and it's only since she was taking the antibiotic.
It could do now. That would be fast, I suppose, Patricia. But like high-strength antibiotics are very, very hard on the liver, which is why they very rarely prescribe them. And that could definitely give your whole system a big knock. So I think I always say for hair, biotin to improve the quality of your hair and Norcrin to improve the quantity of your hair. So it might be that, you're just a bit run down and feeling a bit worn out after the antibiotic and could do with a tonic, and maybe your hair isn't actually thinning at all, maybe it's just a bit lank because you're run down. So in that case, I would take the Source of Life Gold as a great tonic. It'll hopefully pick you up. And if the hair doesn't improve, take biotin for a couple of months. You need about 5,000 micrograms, which would be very easily available. Like we have it in gummy form here as well, even you can have it as a nice tasting gummy. And that's great to improve the quality of your hair overall. And then if you feel it's thinning on your scalp, I probably would nearly consider doing a little bit of liver support after that high-strength antibiotic. And then the Norcrin, Nourkrin, we get great feedback on it, and I've tried it myself once, and it did work for hair thinning on the scalp. And the last thing I'd say, after any high-strength antibiotic, you should be taking a good quality probiotic to get the gut back healthy, because the gut is foundation of all of your health.
Okay, good advice. Okay, somebody who is insulin dependent and has a cough that won't go away, wondering what you would suggest. And again, we're back to this lingering cough. Now, I know the earlier text was after COVID, but a lot of people are talking about lingering coughs.
Absolutely. I think it's something after COVID, Patricia. I don't know. I've asked a couple of medical professionals if it's anything to do with the ACE receptors in the lungs. That's a receptor that's responsible for managing your blood pressure, and they're in the lungs because if you're running away from a woolly mammoth, you need to breathe more, and that then kicks off the whole stress response. So they're also in the kidneys, and I have to say I saw a huge increase in kidney problems over the last 4 years. And I don't know. I've asked professionals if it could be something to do with inflammation in the lungs that's affecting those. I haven't gotten an answer. So really, we really don't know. whatever it is inflammation in the lungs. And I did have it myself. I definitely lost my puff after COVID, even though I had no symptoms the first time around. And all I could suggest is that if it's a dry cough, take the Manuka honey elixir. And if it's mucus, take the Mucotone. And then maybe something like a salt pipe would work very well just to strengthen up those lungs again. Because loads of people end up on the steroids and inhalers after it. And that's what I was told, that I have asthma. Now, I don't take anything for it because it really doesn't impact my life. But a lot of people maybe will find a course of steroids and an inhaler might help in the short term. And then the other thing that might be worth a try is a homeopathic remedy called phosphorus. You should be able to get it in most health stores. Unfortunately, we're finding it harder and harder to get homeopathic remedies. But ask your local health store, they may have it in stock. And take that. That sometimes can work very, very well. And the final thing I would say then is lung tea. Not called lung tea now anymore. Dealish Clare does something called, I think it's called Clear Away tea. It used to be called lung tea. And I found that was wonderful after my bout of COVID this time, just to soothe that kind of raw feeling of coughing in my chest. So you could try those. Yeah,
somebody else kind of describing what you are just talking about there, had a really bad upper respiratory infection, ended up on steroids and antibiotic, left with that awful cough after it. After taking all the antibiotics and the steroids, continued taking echinacea, cold and flu, and a cough bottle. The phlegm has stopped, not coughing up anymore, phlegm, and the cough is starting to get better. But now looking for something to boost his or her immune system. I'm back taking vitamin B complex with 1,000 milligrams of vitamin C, and I'm wondering, is there anything else I should be taking? I'm rarely sick, 49 years of age.
Yeah, I think now the vitamin C is fantastic, but I do think that zinc is a hugely important one, and a vitamin D as well, and they would be the very basic things to support your immune system. But time and time again, we get great feedback on the BioNutri elderberry complex. It has all of those in there. Now, it doesn't have as much vitamin C, but from the research I've done, actually, it doesn't appear that we can absorb any more than 500 milligrams of vitamin C at a time. So taking 1,000 doesn't necessarily mean that you're going to get 1,000 milligrams into your system. And that elderberry complex also has something called beta-glucans. And beta-glucans would be the reason that all of these medicinal mushrooms are so powerful. And the Chinese have been using them now for over 2,000 years for health. And we're starting to see them become more mainstream, and they are fantastic. The other thing I should mention as well, Patricia, actually, for all of this chest stuff is NAC, N-A-C, N-acetylcysteine. I took that as well, and actually I still am taking it every day because I find it's great for lots of things. For me, really, I feel much better on it. And it can be very good for the immune system and very good for the chest. And actually, people who took it post-COVID last year found that when they continued to take it, they didn't need as many or little to no antihistamines in the hay pollen, the hay fever season. So it might help with that as well. So Nature's Plus do a product called Immune Boost, and it's got all of the things I mentioned previous, plus NAC in it. So that's a great one. Either the elderberry complex or the Immune Boost, and take it for the next couple of months till we're over the hump.
OK, I can see two separate questions in about tinnitus. Pat in Shamballimore suffers from tinnitus. She also had vertigo a few months ago and ended up in hospital. Any suggestions for tinnitus relief? And somebody else was wondering, someone else who's diagnosed with tinnitus wonders, is alcohol bad for tinnitus? This sister actually finds a couple of glasses of wine very relaxing, but wondering, is it bad for tinnitus?
The happy answer to that question, Patricia, is I don't think so at all. So in actual fact, if it's red wine, the resveratrol and the red wine could be very naturally anti-inflammatory. If I could invent a cure for tinnitus, Patricia, I'd be such a wealthy woman.
Yeah.
But I think I feel it takes two forms, and the form here it is, I think, where a virus attacks the canals of the inner ear, and it can either result in that vertigo feeling, which is like being seasick or dizzy all the time, and then it can also end up in tinnitus. And we've tried various different things over the years. There was a product that used to work fairly well, but we can't get it anymore. They don't make it. So this is what it was made of. So it had a very powerful, natural, anti-inflammatory complex at the base of it. So what I would recommend for that is the One Nutrition P4 Immune. And then on top of that, it had a probiotic, a specific probiotic that was Lactobacillus salivarius, and that's the one that's really important for the mouth and the whole inner ear system as well. And you'll get that in the BioCult. And I think also the Viridian Pro Daily has that in there as well. So try the P4 Immune combined with a probiotic with Lactobacillus salivarius in there. And some people would say that the rosemary oil, again, is very anti-inflammatory for the inner ear. So you could buy rosemary tea, or you could, if you have rosemary in your garden, you could stew it and make a tea out of it and drink that as well.
Okay. Have you any advice for cold sores? Somebody says a reoccurring, they keep coming back.
Yeah. I suffer for them, Patricia, and I get them in my nose, which is very painful. So if you're prone to getting them on a regular basis, taking lysine as a preventative is the best way. It's simply an amino acid, which means it's a protein. So it's very safe to take no matter what medication you're on. And it's called L-lysine, L-Y-S-I-N-E. And you need to take 1,000 milligrams a day for prevention. This is great as well, Patricia, actually, because it's related to the cold sore virus. It can help with herpes, with preventing the rash, or with with shingles, with making the rash less severe when you have shingles, or if you're prone to reoccurrences of the rash after shingles. Taking lysine out as a preventative works really well. And then you can get a cream to rub on, and it is biopropolis cream. And I've used it for years, Patricia, and I've used all the medications, and I've spent fortunes on different kind of ones from the pharmacy. But this one, without a doubt, takes the pain and the swelling out of it very, very quickly, heals up much quicker, and it doesn't scar as badly. So that's biopropolis cream. You'll get it only in a health shop, and the L-lysine, and that should sort that out.
Okay. All right. Listen, we'll leave it there. Apologies that we didn't get to all of the questions, but thank you for that, Anneliese. We'll chat to you next Monday. Thanks for joining us. That is Anneliese Dressel of the Health Hub Times Square in Ballincollig. And as always, Anneliese will put up all of the items that she's mentioned on her website this afternoon, which is healthhubstore.com.